Hello, my name is Jaden Jones. I'm from Prince George County, Maryland, and I go to Towson University. I'm a sophomore and I'm a business major. Today, I'm going to be presenting on the urgent need to improve access to mental health care in the United States. Mental health is a critical part of overall health, yet millions of individuals still cannot access timely or affordable treatment. I will outline the current barriers to care and propose 2 policy solutions that can significantly improve access and outcomes. First, mental health conditions affect approximately 1 in 5 adults in the United States each year, according to the National Institute of Mental Health. Despite how common these conditions are, access to care remains limited, especially in states like Maryland, where the provider shortages are significant. Many individuals face long wait times, high costs, and difficulty finding available providers. These barriers often prevent people from receiving care until their conditions become severe. To address these issues, I propose 2 key policy solutions. First, increasing the federal funding for community mental health centers would allow for expanded staffing and more accessible local services. Second, making telehealth services permanently available through Medicare and Medicaid, and I believe that it will ensure continued access for individuals who face transportation, geographic, or scheduling barriers. Secondly, barriers to care. The United States is currently experiencing a severe mental health access crisis. According to the Health Resources and Services Administration, over 160 million Americans live in areas with shortage of mental health professionals. This shortage can lead to long delays in care. Patients may wait weeks or even months before seeing a provider, which allows symptoms to worsen over time. In many cases, individuals are forced to seek help in emergency rooms, which are not designed for long-term mental health treatment. Cost is another major barrier. Even with the insurance, therapy, and psychiatric services, they can be expensive and unaffordable for many families. As a result, untreated mental illness can contribute to worsening health outcomes. It can result in increased homelessness and even involvement in the criminal justice system rather than just giving people appropriate mental care. Policy, solution, and call to action. To address these challenges, I recommend 2 specific policy actions. First, Congress should increase the funding for the Community Mental Health Block Grant program by 25%. This increase would allow community mental health services to hire additional providers, reduce wait times, and expand access for care for underserved populations. Second, telehealth mental health services should permanently be covered under Medicare and Medicaid with full reimbursement for in-person care. Telehealth provides highly significant effective during the COVID-19 pandemic and remains a critical tool for improving access, especially in rural and underserved communities. Together, I believe these policies will reduce wait times, expand access, and decrease reliance on the emergency services. Ultimately, I believe they will create a more effective mental health care system. Thank you.